Good morning, everyone. This video is on chronic pain and how it's fueled by nervous system sensitization. So I'm going to try and unpack chronic pain, but also the anxiety many of you have around chronic pain. So it's almost like a double whammy. And I'm sure I don't need to tell those who are suffering from it. You've got obviously the physical aspects of pain, plus the anxiety around the pain that you're feeling. Will it ever go away? How will I cope? Etc., etc. All the what ifs that come with it. And of course, you might get sensitized as well. So physical symptoms come in. So is it the pain? Is it the anxiety? Is it both? How do I deal with it? What do I do? It's a very requested topic on YouTube. A lot of the comments you ask me to address it. I get emails about it. So I wanted to unpack it here in this video. So I'll do my best to try and at least start by explaining what chronic pain is, how it relates to anxiety, and why both are fueled by nervous system sensitization. That's the missing link, at least in my view, of the work I see around both. So a highly sensitized nervous system, as you know, fuels anxious thinking and anxiety. But I'm going to talk about exactly how it does the same thing with chronic pain. The first thing to think about is just to try and unpack pain itself a little bit. Now, I leverage off the great work of Alan Gordon, who's a psychotherapist, US-based. He wrote a great book called The Way Out, does some great podcasts. So if you've not come across him, please do find his work. And similar principles in terms of what he talks about in terms of dealing with pain, also with anxiety, some slight differences too, but really he provides really useful explanations and reassurances around pain. And so I leverage his understanding of the difference between chronic pain, or what I might call memorized pain, versus actual physical pain in the body. So let's take an example. Just say you break your arm. So it's going to hurt, right? You fall over, you get a fracture, and so there's physical pain that alerts you to the damage so you can take care of it. You can not use the arm, you can get help, whatever it might be, so that arm can heal. So the pain alerts you to the fact that your body physically has been under high stress. Perhaps it's damaged in some form. So you can pull back and you can adjust your behavior. You can take the pressure off the arm, whatever it might be over time, in order to allow the healing process to begin. So the body knows how to heal as best it can. Remember, the body's always driving to get back into balance. That's what is called homeostasis. It's actually not looking to get sick. It's not looking to get unwell. It's trying to drive us back to homeostasis. And there's pain, the purpose of pain is to alert us to the fact that we need to then take care, we need to adjust our behavior in order to heal if we've experienced pain in the form of a fracture, for example. So that's obviously structural pain. In time, the pain subsides, it goes away normally, we get treatment, it heals, and it's gone. So that's great. Interestingly enough, though, people who suffer extreme pain often report that in those moments, the body is able to suppress the pain, to get rid of the pain. So the brain is a very powerful instrument to not feel the pain. So often people say, well, yeah, it didn't really hurt. I didn't feel any pain. There's adrenaline running. There's lots of other things. And so the body is very good at trying to mask pain. And so I guess it's good to just remember that the brain can do wondrous things, but it can also do unhelpful things when nervous system sensitization is involved. So pain, it's a useful, normal mechanism. Where chronic pain comes in, and this is what Alan talks about, he says it's no longer the physical pain being generated. So again, you've broken the arm, it's healed. So the x-rays show it's healed, or as healed as best it can. But you're still getting the same pain. So what is going on? So he talks about the fact that the pain's no longer coming from the injured or the physical injury. It's coming from the pain signal in the brain still being released. It's still signaling that the pain is there. So every time the mind turns to thinking about the broken arm or the arm, to check in with the arm, that pain signal still sends off another pain sensation. So the pain is absolutely real. It's no different to if the pain is coming, the signal's coming directly from the injured part of the arm, alerting you to take care of it. So the pain is not different in the sense that it causes real suffering and it hurts. It absolutely hurts. So it's important to acknowledge that. And that's why it causes so much suffering. I don't need to tell you. It's very difficult to deal with these sensations day in and day out. But much like anxiety, of course, the brain keeps sending off what ifs. What if this happens? What if that happens? It triggers physical symptoms of anxiety. So there's a close relationship between the two. And so the reason why that happens is due to nervous system sensitization. And that's, again, if you've watched my other videos, cumulative stress over the years that's not dealt with, processed, puts tension on the nervous system. All that stress gets registered on the nervous system, so it switches into high alert mode. So this hypervigilance mode, looking out for danger, looking out for problems. So if you're sensitized, broken arm, or you've hit in a really difficult car accident, a highly stressful traumatic event, for example, you get the treatment, the body physically shows that it's starting to heal. It might not heal perfectly, and that's okay. The body is designed to adapt to that. Even if it's not a perfect healing, you might have scars, it might not be perfectly straight, but the body is designed to adjust around that, heal it as best as it can, and stop the pain signal, because the healing's done to the best of its ability. The body doesn't need it to be perfect, a perfect alignment or everything to be perfect, that you can fully stretch out your leg again or your arm again. The body doesn't worry about that. It will alert you to the pain. It's designed to alert you to the pain until it starts to heal, and it always heals to the best of its ability. Often we get help to do that, obviously through our medical system, which is great. But what happens is, of course, if you're sensitized, your nervous system is on high alert, and you've been thinking about your arm, will it heal? You've been through some traumatic events, whatever it might be. The mind is primed to look out for danger. And so it's going to tune back into the pain, potentially. It's going to remember the pain. It's going to activate those pain signals because the nervous system is tired. It's fatigued. It's doing its best to protect you, but it's tired. It's sick of being on high alert. So it's just easier for it to give you the same pain signal, so you take care of the arm even though it's healed. So it's just releasing the same signal as a protection mechanism, purely because it's switched on to this high alert status because of stress. So it's doing what it thinks it needs to do, exactly like anxiety is doing what it needs to do. Stress over the years switches on our sensitized nervous system. So we're looking out for danger. So we start to react from an anxiety perspective to everyday challenges that we don't need to, because the nervous system's tired. It hasn't processed the stress. So the body says, right, well, if you're going to worry about stuff, I'm just going to switch you on. And it's the same with pain. If we've had pain, the body will, through nervous system sensitization, the brain is part of the nervous system, of course. It will get you tuning back into the pain. So that's why I call it memorized pain. Pain still causes suffering. It's painful. That's all real. But the pain, as Ellen Gordon says, it's no longer being generated from the site of the original injury or the damage, because that's healed to the best of its ability. It doesn't have to be a perfect healing for the body to stop the pain. But when we're hypersensitized, hypervigilant, we're going to tune back into it. So I hope that makes sense in terms of just understanding chronic pain versus the physical pain or the structural pain that you feel. What we can then do is, with chronic pain, we can start to apply the same methods, tools, and techniques, allowing, accepting. When the mind tunes into the pain, we allow it, we go loose as best we can. So there's a floating practice, a 30-minute floating practice I recommend you try with this. We don't want to sit in the pain. We just want to, when we become conscious of the pain or we start to worry about the pain, slow down, go loose, allow it, not try and get rid of the pain. Keep going loose whenever our mind starts to think about the pain. And so what we're doing by doing this is we're starting to rewire the brain away from activating these pain signals over time. So through neuroplasticity, by changing our reaction to the pain that we're tuning into, the brain starts to deprioritize releasing or activating those pain signals again and again. Now, it's hard with chronic pain because unlike other anxiety symptoms such as the heart racing, we might get relief from that a bit quicker. But whenever we tune into the chronic pain, it's there, so it feels more constant, and that's what people struggle with. The truth is, though, it's not constant and relentless. As constant and relentless as we think it feels like it, but it's not. I've done another video on that in regards to anxiety, and the principles are the same with chronic pain. There's times throughout the day it's not as severe. There's times that you forget about it, but we don't remember those when we're focused on it. When we're hypervigilant, we only remember the fact that, oh, I haven't had any relief from this for years. And yes, maybe you've been tuning back into it for years, but we can learn to start to tune out of it using the tools and methods I talk about. So I hope that helps as a starting point. Again, watch the floating meditation, allowing, going loose. There's a video on how to let it all happen. We're not trying to get rid of the pain, stop it, anything like that as much as we want to. We're starting to become disinterested in the pain. Oh, there it is again. I'm just going to move on with my day. Going to go to work, hop in the car, go for a walk. Oh, there it is again. If the mind tunes into it, we let it happen and we move forward. And that's how we start to retrain our brain away from it. I suspect I'll do another video on this topic, but I wanted to start with that one. Let me know if you have any questions. I hope it helps, and I hope to see you again on here very soon. Take care.